I'm Mark Thomas. I'm an attorney with Dell Graham, PA in Gainesville, Florida. The real focus of my representation typically is representation of a healthcare provider before some governmental entity, state or federal. I do everything from administrative law litigation, from very simple Medicare and Medicaid recoupment operations, all the way to full-scale federal court defense regarding Medicare and Medicaid reimbursement. I have a statewide practice, so I can get to providers easily from Pensacola to Key West. While I start with most of my work in Florida, actually most of my litigation experience has been outside of Florida, primarily in Boston and in Philadelphia, though I've also done a fair amount of work in the federal courts in Chicago, Dallas, and Los Angeles. Compliance and reimbursement is more important now than ever. One can scarcely pick up a newspaper without seeing yet another cry out of either the state legislature or out of Congress to eliminate fraud, abuse, and waste. Focus on strict compliance with literally thousands and thousands of pages, statutory and regulatory provisions that are extremely dense and oftentimes contradictory. And the margin of error is very, very small, and yet the penalties are amazing. Potential loss of licensure, gigantic penalties, oftentimes treble damages, penalties of up to $11,000 per bad claim. That translates to having auditors, investigators, and even FBI agents in your lobby, looking at your records, taking your servers. Compliance is a matter of setting up safeguards within reimbursement systems to ensure that compliance is as close as possible. The government very much looks for how careful the provider has been. I am a 20-year ex-healthcare fraud prosecutor and Medicaid administrator, now in private practice. Prior director of the Florida Medicaid Fraud Control Unit, on the prior number 2 of the Agency for Healthcare Administration in Florida, which contains the licensing unit for Florida for healthcare institutional providers. I am Florida board certified in healthcare law. There are only 118 board certified healthcare lawyers in the country, so it's a relatively specialized practice, but it's all that I do here at Dell Graham. But while the legal aspects are incredibly important, what's really important is the healthcare. It is magical to stand in the lobby of a hospital or in a doctor's office and see sick or injured people come in the front door and see better people leave out the back door.